For anyone struggling with low back pain, stop doing more stretches. Many women with low back pain have a hidden problem that they think has nothing to do with their pelvis or their spine. You might not know this, but the real reason why women struggle with chronic low back pain is often completely missed by doctors and specialists. These same women almost always have another embarrassing problem that they never talk about because they aren't asked, because they feel ashamed, or because they don't want to embarrass their care provider. When you have back pain, what do doctors tell you to do? Rest, take pain medication, do stretches, and maybe get physical therapy. But here's what they're missing. Your back pain might actually be because of a weak pelvic floor, the same problem that causes bladder leaks and that heavy bulging feeling in your pelvis. Over 95% of women with low back pain have some form of pelvic floor dysfunction, and in the past few years I've seen many women overcome their back pain when they start addressing their pelvic floor issues. More than 10,000 women have already discovered that when you fix your pelvic floor the right way, the leaking and the back pain goes away. Both problems disappear without endless visits to the massage therapist or the chiropractor. This simple method is so effective that the billion-dollar incontinence pad industry doesn't want you to know about it. Why? Because their entire business model relies on you coming back week after week, band-aiding your symptoms instead of addressing the root cause. But now women of all ages are using this simple 12-minute routine to wake up without back stiffness, stop worrying about bladder leaks, return to activities they love, exercise without worry, and feel confident and in control again. The Muff method doesn't just treat symptoms, it fixes the root cause by releasing hidden tension patterns, restoring natural movement, rebuilding core strength, and retraining proper muscle function. All in just 12 minutes a day from the comfort of your own home. Just listen to what these women discovered. One student of mine had back pain, urgency, and stress urinary incontinence for over 22 years. These interfered with her golf game. She peed before she left the house, when she arrived at the golf course, up the 9th hole, at the 18th hole, and when she got back home. She always wore a pad, and she was slowly stopping her daily walks because her back hurt too much. After starting the Muff method, her back pain went away after 2 weeks, and she was leak-free and pad-free within 2 months. Many other students of mine have been able to get rid of their overactive bladder medication. Another student who is 75 is back playing with her grandkids without fear of leaks or throwing her back out. And this student, she hasn't had a leak in over 2 years. I'm currently offering this complete system, which I call the Muff method, the same one that's helped thousands of women for just 17 bucks. That's less than a single physical therapy session. And remember, this works for women at any age, even if you've had children, even if you've had a bladder lift already, even if you've had a hysterectomy, and even if you've tried everything else. You can access it today for just 17 bucks.